Pulsatile tinnitus is a condition where individuals experience a rhythmic, pulsing sound in their ears. Unlike regular tinnitus, which is characterized by a constant ringing or buzzing noise, pulsatile tinnitus is often associated with the person's heartbeat or blood flow. This condition can be quite bothersome and can significantly impact one's quality of life. In this video, we will explore some effective methods to make pulsatile tinnitus go away. The first step in addressing pulsatile tinnitus is to identify the underlying cause. There can be various factors contributing to this condition, such as hypertension, anemia, atherosclerosis, or even certain medications. Seeking medical advice and undergoing a thorough examination is crucial to determine the root cause of pulsatile tinnitus. Once the cause is identified, appropriate treatment options can be explored. If pulsatile tinnitus is caused by an underlying medical condition, treating that condition may help alleviate the symptoms. For example, if hypertension is causing the pulsatile tinnitus, managing blood pressure through lifestyle changes and/or medication may provide relief. Similarly, addressing any other medical conditions contributing to this condition can significantly reduce the symptoms. Another approach to manage pulsatile tinnitus is through sound therapy and relaxation techniques. Playing calming background sounds, such as white noise or nature sounds, can help mask the pulsing noise and make it less noticeable. Relaxation techniques, like deep breathing exercises or meditation, can also reduce stress and anxiety, which may worsen the symptoms of pulsatile tinnitus. Certain factors can exacerbate pulsatile tinnitus symptoms. These may include exposure to loud noises, caffeine intake, smoking, and excessive stress. By avoiding these potential triggers, individuals can minimize the intensity and frequency of their symptoms. Taking steps to protect the ears and practicing stress management techniques are essential for long-term relief. If the symptoms of pulsatile tinnitus persist or worsen despite trying various self-help methods, it is crucial to seek professional help. An otolaryngologist or an audiologist can provide a comprehensive evaluation and recommend advanced treatment options if necessary. Remember, every individual's situation is unique, and personalized guidance from a healthcare professional is invaluable. Pulsatile tinnitus can be a challenging condition to manage, but taking the right steps can help alleviate its impact on daily life. By identifying and treating underlying medical conditions, adopting sound therapy and relaxation techniques, avoiding potential triggers, and seeking professional help when needed, individuals can increase their chances of making pulsatile tinnitus go away. Remember, persistence and patience are key, and with the right approach, relief is possible.